Okay, welcome everyone. Again, I'm Angie Grover, co-founder and COO for Metopio. Welcome. There's a poll on the screen if you're just joining. If you could take that and let us know what you're hoping to learn today from this webinar, that would be fantastic. We'll close that at the end of this housekeeping. So for a bit of housekeeping, for today's webinar, we will have the chat on and we'll be managing it. So if you have questions or comments, this is meant to be an interactive half an hour. So please join in there. The audience will be muted, and we will have time for questions at the end. If we don't get to your questions, we will follow up directly with you. The slides and recording will be distributed after today's call. So let me give everyone one more second. If you're just joining, go ahead, take that poll. I'm going to close it here and share with you all. For today's agenda, we're going to do some introductions, talk about community survey choices, whether or not to survey, how to reach those populations, and how to use technology to advance and do more efficient surveys. So I'm going to close this poll and share the results. So as we get started, it looks like learning more about data collection, reaching those hard to reach populations, and tips and tricks on how to do surveys more effectively are all things we're going to cover. So I think you're going to enjoy this presentation. So with that, I am excited to introduce Metopio's CEO, Will Snyder. Prior to launching Metopio, Will was the Chief External Affairs Officer at Amita Health, a $5 billion integrated health system here in Illinois. In that role, he led all areas of external affairs, including public policy, community health, and community benefit for one of the largest health systems in the state. Throughout his career, Will has really been known for a collaborative and entrepreneurial approach, which I know firsthand, to improving population health. Here in Chicago, he built several healthcare collaboratives, and actually his efforts resulted in the largest collaborative community health needs assessment in the country, bringing together otherwise competing entities to better understand community need and advocate for public policy change. So with that, I am thrilled to introduce Will Snyder.
Thanks, Angie, and thank you all for joining our webinar today. Excited to talk about the wild world of community surveys. And I want to start just kind of at a high level, thinking about surveys. In particular, what we're talking about today are community level surveys, really centered around community health needs assessments, community health assessments, population health work, and so forth. There's certainly a lot of other reasons to deploy surveys to create certain data sets and so forth, but really the focus today is going to be around that assessment framework. And one of the questions we get the most often at Metopio is, well, what kind of sampling am I doing here? Like, and if I run a survey, am I actually going to get results that are reflective of the community or the prevalence of disease or the burden of disease and so forth? Or am I going to get 98% of my respondents being retired, likely female respondents who, for whatever reason, they just statistically are much more likely to fill out surveys. And it's a challenge that all of us have run into, and we're really excited to have Erica and Lindsay here today because I think they can speak to some really novel and smart ways to expand the pool. So, or the response pool. So when you think about surveys, there are a couple of structural questions that you need to work through before launching. Certainly you want to understand, what is it you're trying to achieve? What do you need to understand? So that will guide the question structure that you're using. There are a lot of validated questions and also just full survey structure templates that are offered by places like NACCHO, Catholic Health Association, American Hospital Association. They all can help you find survey instruments that can help you really understand those community health assessment challenges. So again, figuring out your instrument, how long do you need it to be? People do not like long surveys. They generally want to be in a survey environment for under 10 minutes, which means you can get about anywhere from 40 to 70 questions, depending on how they're worded, within a 10-minute framework. We've worked with a number of clients who are happy to have like a 3-question survey as well, beyond the demographic setup that you need to understand who's taking the survey. Then they just really want to understand, what do you see as major health issues? What do you see as strengths and potentially weaknesses in the community? So you figure out generally the questions you're going to ask align with what you need to know and where there are gaps in the data. After that, a really important step, though, to understand how to validate and use your survey data is your sampling structure. And so what you see on the screen here are the 5 most common ways to think about sampling for any survey. What we often see most commonly for community health assessments is the first one and the last one. So quota sampling is, if we go back to the survey or the poll that you all took before starting the webinar, people are really interested in how you reach underserved populations. And I know Lindsay and Erica can speak to that in a couple of minutes, but the way you would start to structure that is thinking about quota sampling. And so you're able to then design your distribution plan around specific populations, whether that's based on racial or ethnic stratifications, income, education level, rural versus urban, whatever your slices of data need to be, thinking again about that quota sample and how that builds up to your overall target sample size that you need for your survey. This can also be a really valuable method for engaging community partners. We think about survey distribution in 2 kind of macro ways at Metopio. So direct to consumer, so B to C, hello, you've been identified, please take this survey. And then also what we kind of call B to B to C. So from Metopio or a health system or a health department to a community partner who then distributes it to their network. And so be able to equip those churches, community-based organizations, FQHCs, free clinics. We've learned a lot of really cool ways to do this from the POGO partners, who will speak a little bit too about like those channel partners that can help. And that's really where you can help. You can really see an increase in response from certain demographics within your quota sampling. Representative sampling is what it says it is. Again, just really kind of thinking about a demographic slice. This most often involves looking at race and ethnicity and potentially income levels. When you think about representative sampling, statistically valid sampling, hopefully everything you do is statistically valid. We can help you understand how you make the math work there. But again, this is really thinking about very specific slices of your population and what you need in order to achieve valid insights from those, or derive insights, I should say, from those population groups. This is, again, this kind of combined with quota sampling gives you a very accurate way to understand data. I think the other important piece that I'll call out on statistically valid sampling is you really need to be thinking about at what level do you need to view the data. So you can run a survey across a full service area or an entire county or region, but sometimes people want to look at sub-county data. So they want to see data at a zip code level, or they might want to see it even in a census tract. And that's where you really need to make sure that you've set up a statistically valid sample in order to derive those insights. The most common one that we see used in public health, especially when, equipped with resources such as time and money, is random sampling. And that most frequently was done in the old days by random dial. So just, take the phone book or take a directory and start calling people. Unfortunately, people don't use phone books anymore. They don't have landlines. And so there's a lot of work that needs to be done around how you create that random sample. And there are ways to do it via online survey tools. And certainly the old-fashioned methods of getting a list, and now usually you see it pushed as a text message, but also still doing random dial for cell phones. I'm a classic problem case here for how random sampling becomes a challenge in a place. My cell phone I acquired years and years ago. I won't tell you how many years ago, and I've just been too lazy to ever update the area codes. My area code is in Virginia, even though I live in Chicago. So that's sort of one of the problems that you run into with random dial now, is that people are so dispersed geographically, but their phone number might not be tied exactly to the phone construct of that place. And then lastly, as I said, convenience sampling is usually what we see in, speed to response, survey distribution, budget constraints, and so forth. There's nothing wrong with convenience sampling. You just really want to consider your weighting structure out of that. Something that we spend a lot of time and energy with at Metopio is thinking through exactly how the data exists and how it can be best calculated to create as representative of insights of the community as possible. Jump to the next slide. So the big question, right? Surveys are hard. they can be gnarly and so forth, but we love them. We love seeing responses come in, and it's gotten a lot easier just even in the last couple of years. I think during the pandemic, we saw, interestingly, people became more receptive to surveying, probably because they were, at home or in some sort of lockdown, maybe a little bored. But then what we also see is like during major political cycles, like the last year, people get really burned out on surveys because they're being asked for information quite a bit. To survey or not is certainly a question you have to answer for your organization. If you ask me, I would say yes, you should always survey because of the 4 reasons that you see on the screen. Mostly because surveys yield really rich local gold. They give you local data that is otherwise very, very difficult to attain. um, they really help you think about this first bubble, this idea of burden. So we can use data from federal and state sources or even local sources to understand prevalence. But a lot of times what's missing in disease data, whether it's communicable or infectious disease data from the CDC or state level resources, is the burden component. And so community surveying really becomes an incredible way to best understand what what are people really suffering from, or what is really causing people not to be able to pursue healthy choices in their life or in their community. So the burden piece becomes a really valuable output of community surveys. Second, I mentioned a lot of data sources. Some of those data sources are undergoing some transformation right now, and the release schedules can change and so forth. But when it's out there, you still want to go a step further and validate the secondary data. A lot of the data that we receive from federal sources, while incredibly valuable, is modeled. And when you are surveying, you're able to create that primary data set that can help you further validate what's being released from the secondary sources. Another way to really think about the value here is people get excited when they're asked to do something. And surveying is the first step, then really addressing community need through your implementation strategies is the second step. So if you've got an engaged community and you've got engaged stakeholders, that's going to help with that lift of really trying to address the issues that are raised through the survey, through focus groups, and through other data collection. And then lastly, I sort of touched on this. This is, this creates a gold mine for your institution. You've got the data. You're able to use that and grow that data set over time. We see here in the city of Chicago, they've run the Healthy Chicago survey for years now, and they've got a really valuable longitudinal data set that helps policymakers, healthcare providers, and citizens really understand, what's changed, what hasn't. And I think something that's very interesting in that is being able to see the effects of the pandemic, how that impacted life expectancy across all racial and ethnic stratifications, how we're seeing economic recovery happen in different pockets and in different ways across the city. And those insights become really important for driving a larger policy discussion as a city. So anyway, just a high level one to walk you through, how to think about it and then whether or not to do it. And Angie, I'll turn it over to you for the next chapter.
Thanks, Will. So now is when we want to get you engaged as well. So I'm going to do some introductions and launch our next poll, which we're going to talk about reaching those hard to reach populations, which was one of the things that you all wanted to know more about. And bear with me as I navigate my polls here. So we actually want to know what creative ideas you all have deployed to reach hard to reach populations. And so I'm going to leave this poll up while we're discussing and doing introductions. We would love to know from you all, what are some of the things that you've done to get to these hard to reach populations? So with that, I'd like to introduce Lindsay Goodson. She's the Senior Program Manager and Public Policy Advocate for Potawatomi Go in Potawatomi County, Oklahoma. Lindsay has a really interesting background. She was in the hospital. She was a hospitality leader by trade, and then moved into a role to support the Community Food Resource Center. And so doing that work, she was selected as a steering committee member of the Blue Zones Project in Potawatomi County. And some of the creative ideas they have, she's adapted from that experience into the community health work that she leads. And Erica Bird began her public health career at the Allegheny County Public Health Department in Pittsburgh, but then she moved to Syracuse, New York to pursue her Master of Public Health degree jointly with SUNY Upstate Medical University and Syracuse. And through that degree program, she had completed an applied practicum with Madison County Public Health, where she is today. She served as a health statistician, a quality improvement coordinator, and is now the deputy director. So a little bit of context too, as like Pottawatomie County, Madison County is a rural community, predominantly rural with 68,000 people. And she's going to talk a little bit about how she found her hard to reach populations. So with that, Lindsay, can I turn it over to you first?
Yes, thank you, Angie. Hi, everybody. I'm Lindsay Goodson. I'm as Angie said, the public policy advocate and senior program manager for Pottawatomie Go here in Pottawatomie County. We're actually in Shawnee, Oklahoma, but our service area is all of Pottawatomie County. And Angie asked me to share with you guys a little bit about our project that we completed about this time last year almost, which was our community health needs assessment and the unique ways that we were able to reach populations throughout the county. So Pottawatomie County has a total population of 74,000 people, and the majority of them living outside of Shawnee proper. And so our goal was to reach 5% of have 5% of our county residents respond to the survey. And we did all of the things that Will talked about, the random sampling, the validation. We partnered with University of Oklahoma College of Public Health to help us with the survey tool and all of the data compilation and all of the good stuff. And then the real theme of our community health needs assessment was partnership and collaboration. So that started with our nine organization task force, which included the hospital, county health department, some other nonprofits, and our foundation, who's actually our parent company. So 5% of our county our total that we got to was 3176, so 3,176 respondents. We really needed only 2,738 to get to our goal. But the important part is we had to partner with over 60 community partners throughout the county to reach that goal. When my boss, John, who is much more charismatic at these presentations than I am, I wish he could have been here today for you guys, but he was very enthusiastic that we could do it. And I was like, that's a lot of people, John. I don't know. And so we really knew that we had to tap into our partnerships. We worked, of course, with our 9 task force members, the health department, the hospital, our tribal clinics. They were also represented on the task force, dental clinics, banks, coffee shops, restaurants and grocery stores, community market. So we would go to the community market, which is a food and resource center, and actually sit with people who maybe were illiterate and needed help completing the survey. We would do that on the iPads with them. Schools, work sites, churches, I mean, you name it. And we were there to engage with the population, because we didn't want it to be just our friends that were completing the survey. We needed to really hear from Census Tract 5002 about what does it mean to live in a food desert? What is your lived experience? And so we had to get out of our comfort zone and go to where they are. So a couple of unique things that we did, and I asked the team what they wanted me to report on today. And the 3 things that came to mind are, we worked with municipal water bills. It's not the water, when the water bills would be sent out, we had a QR code and the website for people to engage that way. We know that everybody's paying the water bill, or receiving a water bill. We also have a great partner in our local Chick-fil-A. They are an interesting group that you wouldn't necessarily think of, but because that's where people are going there, right? And so they let us put signage up. We printed what are called buck slips, which we also used with the banks. And they let us stand in the drive-through line and ask people to complete the survey, which was a huge success for us. And then we also have a partner called Community Renewal, and they work with the schools, and they have a bear costume, the We Care Bear, and the We Care Bear stood in the pickup line several days a week and asked people to complete the survey. So not only were we sending out the buck slips or the reminders or the virtual push notifications to schools, but we were actually there also speaking to them too. So that's kind of how we did it. I would love, Angie's going to share my email address later. I would love to connect with you all if you have any further questions. And you can also find all of our information at gopogo.org/CHNA.
Thank you, Lindsay.
Yeah.
Some interesting tactics there. I know, Erica, you also work in a rural community. Can you share a little bit about where you started and how you ended up reaching a population that you really wanted to hear from?
Absolutely. So thank you for having me. We are on week 5 of 6 for our community health assessment survey. So I am knee deep in that right now. As Angie said, we serve 68,000. So as reference, that's 385 sample size that we were looking for. As of today, we have about 700, which is awesome. We are very well connected with our community partners. We leverage those first and foremost to reach our low income individuals, our seniors, and we also pushed out through employers. Where we struggled was kind of to Will's earlier point, the inverse of retired women, young people in general, 18 to 24, and then men across the board of all ages. Most people in my community go straight into the workforce. We only have about 25% that pursue college education. So after, we couldn't really get, we didn't get a lot of responses through the employers. We were, as a group, brainstorming, well, where do men hang out? And that brought us to snowmobile clubs. Especially in the heart of winter, there's not a lot of outdoor things going on, but that is one that is wildly popular here. So the first club we called, they were actually passing out raffle tickets for their annual fundraiser. So in that distribution, we sent our survey link and information. And within 2 days, between that raffle distribution and email distribution of the other clubs, we got 74 responses, predominantly men, and even some in that 18 to 24 age group. So that was kind of our gold mine and success of this year so far. We'll obviously need to do some weighting to make sure our survey is still representative, but that was kind of that unlikely ally.
Thank you, Erica. And we've closed the survey and I have some of the results, I think, on the screen. If not, you have to bear with my Zoom operation today. But we are really interested in how you all are doing that. We'll put that together and share out to the group of everybody who's participated what some of the creative ideas were in terms of reaching these hard to reach populations. I know in North Carolina, we have been working with them and deploying a survey, and we've been able to work with our community health workers to get out into the community. And Will, as I bring up how you look at surveys using technology to round out our conversation, do you want to touch just a little bit on the interesting thing that Northwestern Medicine did to reach some of their unique populations?
Yeah, so this is, again, back to you can do direct outreach, hand stuff out to people at local events. You can also do things at really large scale. So Northwestern has a really advanced social media operation, and they were able to do geofencing around areas that they were interested in increasing surveys for through Facebook, Twitter, and other platforms. And they can set within the settings there that they need responses, or they want to display posts only to these certain areas and potentially even certain demographics. And as a result, we're able to hit some pretty lofty targets very accurately and very quickly. So there's all sorts of scale, from direct contact, face-to-face contact, up to algorithmic targeting and so forth in survey distribution. So it's really neat to see that wide range. And then lastly, yeah, just want to take a second before we wrap up and show you kind of how this data can start to work. So this is a survey that's been in the field with Christus Health in Texas. Similar to Erica and Lindsay, they're working in a fairly rural area of Southwest Louisiana. In this case, they were targeting about 350 or so responses. This shows that data by zip code. And then they also were able to set within the platform their targets. So they can go very quickly between, while they're running the survey, being able to see, okay, here are responses. So here's one again. They've a lot more females than male respondents. But again, it works out based on the sampling they set up. Back to the earlier slides, they were able to track really closely to what they needed for their statistically significant sample. And then they're able to see, okay, how are we doing response-wise? And while this is in the field in real time, these are updating every day. They can then adjust their outreach to one of the questions, or one of the survey responses earlier, to be able to see where are they missing responses and really kind of target and focus with their community partners. Once the data is collected and in, then they're able to go in and analyze by question. So this is a pretty cool stratification they did, where they also surveyed their employees, because they wanted to see how their employees compared to their community members and patients. So in the case of the flu vaccination, a lot higher rates for their staff than in the community. And then when you look at the community members, interestingly, with the stratifications, and these are weighted results, the Hispanic and Latino population was the most vaccinated against the flu from their survey sample. And then they're able to also visualize questions like this, which is respondents who had to struggle for basics. And then you can see the definition here. So hard or very hard, on the question of how hard is it to pay for basics like food, utilities, and transportation. So just a very quick way to see how you can use technology to track and kind of do project management while your survey's in the field, and then to be able to take that data and then turn that into really rich insights and think about, again, how you slice and dice it becomes pretty exciting. And I just want to call out Christus Health for that, of surveying both their employees, who they, as they rightly said, they're members of the community. So how does that look when compared to the rest of the community at large? It becomes really interesting when you think about social determinants of health, access to care, and those kinds of things. So thanks, Angie.
Yeah, and as we come to the conclusion of our half hour, we have been doing this series of webinars. So we started with the future of CHNAs and how we're changing what CHNAs look like, how you can do them with tools and technology with Baylor Scott and White Health. Today, we're so fortunate to have Lindsay and Erica join us to talk about the survey component. This is something people struggle with. Metopio being a data platform, providing automated tools for your assessments and your chips. We really wanted to dig into, how can you do your surveys differently, and how do you really reach those hard to reach populations? And our next webinar, if you'd like to join us for the completion of this series, is how to take that really rich data, like Will was talking about, that really hyper local data, what we have to offer in terms of combining that local data with your lived experience in your community and the secondary data to shape your chip and make it as effective as possible. So we've got that up on the screen. We've also got Erica, Lindsay, and Will's contact information. As a follow-up to our webinar, we'll share all those great ideas that you guys took the time to enter in the chat. So look for a follow-up of the recording today of that asset that we'll share, and hopefully we'll see you on our next webinar, where we talk about turning these assessments into effective community health improvement plans. Thank you so much for taking the time to join us today. We know that your time is valuable, and we really appreciate all the work that you do to make our communities healthier. Thanks so much, everyone. We'll talk to you soon.